Hi, my name is Robert, and I'll be educating you on prenatal education during pregnancy. I'll verify the patient's identity by asking them their name and date of birth, and also checking the wristband, and I'll do hand hygiene. So, first we'll discuss doctor's appointments during pregnancy and how often they happen. We'll talk about diagnostic tests that are done and labs that are done during pregnancy and at what point they're done during pregnancy. All right, so your first visit with the doctor, they'll do a full health assessment. Um, do a full health assessment. They'll get a UA. They'll do ultrasound, pap smear, pelvic exam. They'll do a full. Doctor asks you a bunch of questions about full history on medical history, pregnancy history, lifestyle, relationship, education, finances. So it's important to be honest with the doctor. Um, so for weeks 4 through 28, you'll go once a month, and at week 10, you can and each one of those visits they'll do UA, and at week 10 they'll do ultrasound. You can hear the heartbeat and a UA also, and they'll measure the growth of the baby. At week 20 they'll do a ultrasound anatomy scan, and they'll give you the sex of the baby, and they'll also do UA. And then at week 26 they'll doctor will do a glucose tolerance test. It'll take an hour, and it sees if you have gestational diabetes or it puts you at risk for it. And there's a 3-hour test to be done if needed. So from weeks 28 to 36, you'll go twice a month, so every other week. And at weeks like 35, they'll do a strep B. So it's a bacteria they check for. It can be harmful to the baby. It can be given during the delivery. And they'll give you a Tdap to prevent whooping cough and pertussis. And weeks 36 through 40, you'll go once. I mean, for weeks 36 to birth, you'll go once a week. You'll do a UA at all those, and um, they'll do labs to check your blood levels, to check for anemia, to check your HCG. Um, they'll do genetic testing, check for Down syndrome and neural tube defects. They'll check for infections like toxoplasmosis, STIs, syphilis, gonorrhea, HIV, and they'll also see. Oh, they'll check your blood type, RH factor, and also they'll check if you're immune to rubella and chickenpox. And if you're high risk pregnancy, you'll see the doctor more often. Next, we'll discuss nutrition for a healthy pregnancy. We'll talk about foods and supplements that consist of a well balanced diet during pregnancy. Um, excuse me. Um, well balanced diet. All right, so we'll start off with a well balanced diet is very important. Um, you want high nutrients, high in fiber. You want low in fats, salts, and saturated fats. Foods to eat for a well balanced diet consist of whole grains, beans, legumes, fruits, vegetables. You can do lean meats and poultry that's well done, nothing undercooked for the meats. And prenatal supplements are encouraged during pregnancy. You want some with folic acid in it to prevent neural core defects. You want omega 3s to help the brain development of the fetus. And iron prevents anemia. Vitamin D, calcium, and iodine also should be in there. And I will discuss exercises, how much to do, what ones to avoid during pregnancy. All right, so exercise is recommended during pregnancy. It's recommended 30 minutes a day for 5 days a week, so 150 minutes a week. Um, the main goal for fitness during pregnancy is to maintain your fitness level, and um, you can weight train and do aerobic exercises during pregnancy. Things to avoid is things that can injure your abdomen, things that are high impact on your joints, like sports and high impact exercises. Avoid scuba diving during pregnancy. Avoid exercising in the heat and drink plenty of water. And next, we'll discuss BMIs for underweight, normal, overweight, and obese patients. I'll give you the BMI for each and amount of weight expected to gain during pregnancy. Weight gain is normal during pregnancy. Too much weight gain can cause complications. The expected amount of weight gain during pregnancy should be between 25 to 35 pounds during pregnancy. So if you're underweight and your BMI is less than 18.5, you should gain 28 to 40 pounds during pregnancy. If you're normal weight and your BMI is between 18 and 24, you should want to gain between the 25 and 35 pounds during pregnancy. If you're overweight and your BMI is between 25 to 29, you should want to expect to gain 15 to 25 pounds during pregnancy. And if you're obese and your BMI is over 30, you should want to gain 11 to 15 pounds during pregnancy. Next, I'll discuss the 3 common complaints during pregnancy and how to prevent them. The first complaint is nausea and vomiting. To help prevent this, you'll carry a snack with you, eat small meals throughout the day, don't eat spicy foods. Um, Ginger tablets can help, and also medication from the doctor. And the next one is constipation. Um, to prevent this, increase your fluids and fiber, and ask the doctor if a stool softener is okay. And for stretch marks, to prevent this, you can do lotions that are safe. There are lotions that are safe during pregnancy, so look out for those. And also vitamin E oils that can be put on abdomen, your sides, and the breasts. And last part, I'll discuss 3 warning signs that you should contact your provider. And I'll give you the symptoms of those also. So the first one is if one leg is red, swollen, hot. This can indicate a DVT or deep vein thrombosis. You should talk to your doctor. The next one is severe persistent headaches. This can mean you have high blood pressure. Your blood pressure is high, and it could be having possible preeclampsia. Um, and also the last one is severe abdominal pain with vaginal bleeding. This can mean abrupt show placenta, which means when the placenta separates from the uterus wall. And that was it for my education on prenatal education. And let me know if you have any questions. Thank you.